Inflammation in the appendix due to any infection is called appendicitis. The appendix is a finger-like tube located at the cecum region of our large intestine. It is known as a vestigial organ, meaning it has no function in the human body. However, according to some studies, the appendix plays an important role in improving our immune system. Besides this, useful bacteria can also grow in the appendix, which is important for our digestive system. Additionally, cells lining the appendix secrete mucus. In some cases, the appendix may get blocked due to fecal particles or infection, which prevents mucus from coming out of the appendix, causing it to become inflamed. This inflammation leads to severe pain in the abdomen, with right-sided abdominal pain being a major symptom of appendicitis. Patients may also experience fever, vomiting, and nausea. Based on these symptoms, doctors can diagnose appendicitis using CT scans or ultrasounds. When the doctor observes inflammation in the appendix, it becomes a medical emergency that needs immediate treatment. If left untreated, there are chances that the appendix can rupture, leading to the leakage of fecal material into the abdomen, which is a life-threatening condition for the patient. To treat appendicitis, a surgical procedure called appendectomy is performed to remove the appendix.